If you've ever thought about getting a vasectomy or someone in your life has mentioned it, you might have lots of questions such as, does it hurt? Is it permanent? What actually happens during the procedure? And for many men, a big question is, does it affect sex? These are completely normal questions. A vasectomy, also known as a male sterilisation, is one of the most reliable and straightforward forms of permanent contraception, but it is not a decision to rush. Today, we're going to talk through what it involves, what to expect both before and after, how to know if it is right for you, potential complications, and where to find out more about the procedure if you still have questions after all of this. I'm Dr. O'Donovan, a licensed doctor here in the UK with over 10 years of clinical experience. I've helped many men over the last few years find out if a vasectomy is the right option for them. But just before we start, please do remember that this video is for general educational purposes only. It's not a substitute for personal medical advice. Please remember, if you're thinking about having a vasectomy, always speak with your doctor, family medicine physician, or your own healthcare provider to discuss your own circumstances. So let's start with the very basics. What is a vasectomy? Well, a vasectomy is a simple surgical procedure that acts as a permanent method of contraception for men. It works by blocking or cutting the tubes that carry sperm from your testicles to the penis. These are called the vas deferens, and you can see them on the anatomical diagram on screen now. Now, after a vasectomy, you'll still produce semen and ejaculate normally during sex, but your semen will no longer contain sperm. Now, this means you can't make your partner pregnant. In the UK, vasectomy is available on the NHS, though there may be a waiting list, and there are private options available. In the US and many other countries, it's available through family medicine or urology clinics, and costs can vary depending on insurance. Now, it's important to note a vasectomy does not protect you or your partner against sexually transmitted infections. You'll still need condoms if you want protection from infections like chlamydia, gonorrhea, or HIV. So who can have a vasectomy? Well, a vasectomy is suitable for anyone who's certain they don't want to have children or don't want any more children. It's often chosen by men who already have a family, but there is no strict age limit. That said, because it is a permanent form of contraception, doctors will always make sure that you've had time to think it through carefully. Now, if you're in a relationship, it can be helpful to discuss the decision together, though legally the choice is yours. If you're unsure, the doctor may recommend waiting or exploring longer-acting reversible options, things like the contraceptive implant, the injection or intrauterine device for your partner. So if you think this is the right decision for you, how can you get a vasectomy? Well, here in the UK, you can start by booking an appointment with your GP or at a sexual health clinic. In the US or elsewhere, you might need to contact your family doctor, your urologist, or local reproductive health clinic. Now, at this first visit, a doctor or a nurse will explain what's involved, discuss risks and benefits, and answer any questions you may have. Now, if you decide to go ahead, you'll be referred for the procedure, and sometimes there is a short waiting period. Private clinics can also perform vasectomies, often with shorter waiting times, but there will be obviously a cost attached to this. Now, before the surgery, you may be asked to shave the scrotum a day or two before, shower or bathe on the morning of the procedure, as well as bring or wear supportive underwear, and this helps to reduce swelling afterwards. It's also a good idea to have some painkillers ready at home. Ibuprofen or paracetamol are usually recommended, and make sure that you've got someone to drive you home after the procedure, as you won't be safe to drive yourself. So now let's cover what happens during a vasectomy. Well, the procedure itself can be done at a GP surgery, a family clinic, or hospital. You'll lie on a treatment couch while the skin of your scrotum is cleaned and numbed with a local anaesthetic. Once the area is numb, the doctor will make a tiny cut or puncture in the skin, locate each vas deferens tube, and then cut, seal, or block them. Now, like I mentioned, this stops sperm travelling from the testicles into the semen. Finally, the small incision is closed, often with dissolvable stitches, or it's left to heal naturally if the no scalpel technique is used, and that is available, so please do talk to the person who's conducting the procedure. Now, the whole process usually takes about 15 to 20 minutes. You can expect some mild bruising or discomfort, but it is generally well tolerated. Now, if you've undergone a vasectomy and want to share your experiences to help other men, please do feel free to leave a message in the comments section. This can actually be really helpful for others who are undergoing a similar process, and it does help people know what they might expect and can help relieve anxiety. Now let's briefly just talk about recovery. And in terms of recovery, it is normal to have some pain or swelling in the scrotum for around a week or so afterwards. Simple painkillers, like I mentioned, can usually help. Wearing tight-fitting underwear for about a week gives extra support and can reduce swelling. So avoid loose boxers and instead you can wear Y-fronts or a jock strap. Now try to avoid heavy lifting or strenuous exercise for at least a week or two, so no lifting of weights, things like squatting or deadlifts, and follow your doctor's advice about returning to work. Typically most men are back within 24 to 48 hours, but it does depend on the type of job that you do. Now it's also normal for erections to feel a little bit uncomfortable for a few days, and there may even be a small amount of blood in the semen at first, but this should settle quickly. Importantly, and this surprises many people, you're not actually immediately sterile after a vasectomy. It can actually take around 12 weeks for all sperm to clear from your system. Now you'll be asked to provide one or more semen samples for testing to confirm that no sperm are actually present after the procedure. Now until that result comes back clear, you're going to need to keep using another form of contraception, so for example things like condoms. So how effective is it? Well, when confirmed by testing, vasectomy is over 99% effective, meaning it's one of the most reliable forms of contraception available. Once successful, you don't need to think about birth control again, unless you want protection against infections. It doesn't affect testosterone levels, sex drive, or the ability to get an erection. Your body still produces sperm, but they're absorbed naturally without harm. Now, in terms of reversing a vasectomy, some men do later change their minds. A vasectomy can sometimes be reversed, but it's important to understand that this isn't always successful. Therefore, you should assume that when you're going in for a vasectomy, it's most likely not going to be reversible. Now, reversal involves microsurgery to try and reconnect the tubes. Success depends on how long ago the vasectomy was done and other factors, but fertility doesn't always return. Now, in the UK, reversal isn't usually available on the NHS. In the US and elsewhere, it's usually a private procedure, so it's best to approach vasectomy as a permanent choice from the start. So now let's talk about some possible complications, because while vasectomy is generally very safe and straightforward, no surgical procedure is completely risk-free. The most common side effects are typically mild, so a bit of bruising, swelling or tenderness in the scrotum for a few days. Some men notice a small yellow lump under the skin. This is called a sperm granuloma, which happens when sperm leak into nearby tissue. It's harmless and it usually settles with anti-inflammatory painkillers. Occasionally, an infection can occur at the incision site. This might cause redness, warmth, or discharge and would typically need antibiotics. Now, a rare but recognized complication is something called post-vasectomy pain syndrome, or PVPS. This is a long-term testicular pain that can appear months or even years after surgery. Now, it is uncommon, but when it happens, it can usually be managed with medication, and in rare cases, with further surgery to relieve the nerves causing pain. If, after your vasectomy, you notice that pain or swelling suddenly gets worse or doesn't improve after a few days, if you develop a fever, or if you see blood or pus leaking from the wound, get medical help as soon as possible. Now, you should contact your doctor or your healthcare provider, or if you're in the UK, contact NHS 111. If you're elsewhere, please reach out to your family physician or a urology clinic. And if you've got severe pain, a rapidly enlarging lump, or you feel generally unwell, call emergency services, so 999 in the UK and 911 in the US, or your local emergency number elsewhere in the world. So, in general, a vasectomy is a quick, safe, and very effective way to take control of your fertility. It doesn't affect your hormones or sexual function, and once confirmed successful, it provides lifelong peace of mind. But because it's designed to be permanent, it is a choice to make carefully with full understanding and support. If you're considering it, have an open chat with your doctor or healthcare provider and ask any questions that you need to. Remember to take your time and make the decision that feels right for you and your family. If you found this video helpful, why not check out this video next?